Welcome to MedTalk. Today's topic is how oral health impacts overall well-being. Our guest today is Dr. Shankar Iyer, renowned prosthodontics from New Jersey. Dr. Shankar Iyer graduated with honors from the New York University College of Dentistry and went on to pursue graduate studies in prosthodontics from the same university. Currently, he holds 2 appointments in the Department of Periodontics and Prosthodontics at Rutgers University School of Dental. Dr. Iyer is a diplomate of the American Board of Oral Implantology and Implant Dentistry and a fellow of the American Academy of Implant Dentistry. He is the director of the prestigious AAID Implant Maxi course held in Asia with centers in Abu Dhabi and Bangalore. Dr. Iyer was the first Asian to be president of the American Academy of Implant Dentistry, and he has lectured in over 30 countries and trained over 3,000 dentists worldwide. Welcome, Dr. Shankar Iyer, renowned prosthodontics from New Jersey. Our topic today is how oral health impacts overall well-being. I'm very delighted to have you at the show. Can you give me a little background of what is oral health?
Thank you, Dr. Patel. At the outset, thank you for putting this whole series of healthcare talks together, and what an honor to be part of this endeavor to kickstart this program. So looking at dentistry from about 10 decades ago or 5 decades ago, we've always been associated with pulling teeth and only with pain. Dentistry has come a long way in terms of how it's being viewed as a part of a overall healthcare overview. So when you look at the patient from a perspective of general well-being, we become part of the first line of defense in terms of the diagnosis. We start looking at the patient from the time they start walking into our offices. We look at their overall facial profile. We can detect anemia from the paleness of their skin. We can detect conditions like scleroderma when we ask them to open their mouth. And from the odor, we're able to detect a lot of other conditions too. So looking at from the correlation perspective, there are several medical conditions that become evident to a dentist. I don't even have to look at the patient. I look at the radiographs, and from the radiographs you can see that this patient probably is predisposed to some kind of a diabetic condition or cardiovascular disease. We are also able to find out if there's any connection in terms of kidney diseases from the way the teeth and the mucosa looks like. So we are able to advise the patients that they probably need to have a medical consult because of the fact that the mouth is a reflection of the overall well-being of the patient. So I think it's imperative to have this correlation so that the patient is aware of their systemic health as well.
So dentists are part of the overall medical diagnosis and management.
Without a doubt.
Absolutely.
Absolutely.
So a lot of patients, chronic disease patients, diabetes, hypertension, cardiovascular disease are on medications. They take many medications, 8, 10 per day.
Right.
What impacts on oral health from those medications?
I'm glad you point this out, because as physicians, you always want to take care of the patients and give medications. Many of the medications that are given to the patient has a direct effect in the health of the mouth. For example, if somebody is hypertensive with high blood pressure, we usually give the patient a diuretic. Diuretics make the mouth very dry, and when you have dry mouth, that predisposes patients to a lot of cavities. It predisposes the patients to a lot of burning mouth syndrome. So the mouth becomes dry and they're not able to taste their food as much. Let's look at an aspect of osteoporosis. Many of the medications that the patients are given postmenopausal do have a direct relationship in the well-being of the jaw bones. We've seen that after extraction, some of the jaw bones don't heal too well, and we are fighting a losing battle in trying to create a balance between their general health and well-being in terms of fighting osteoporosis and trying to keep their mouth healthy. So we are always constantly trying to work with our orthopedic surgeons and the physicians to see how best we can prevent some of the grave consequences of these osteoporotic medication. A third aspect is patients on antidepressants. It was not very common in the past, but right now we see a preponderance of prescriptions being written for depression or for bipolar disorders. These medications like lithium and SSRI inhibitors, they do precipitate some amount of nocturnal bruxism. The patients start grinding their teeth. They also start to have dry mouth. And this has an effect in terms of developing decay and fracture of the teeth and causing some jaw pain in the long run. And there are, a slew of medications that we know of which has a direct effect on the well-being of the gums as well. Another common medication is an antihypertensive pill called calcium channel blockers, amlodipine, verapamil. These are medications that cause gingival hyperplasia. And that's difficult to control because with brushing and cleaning your teeth, it's not going to go away. This hyperplasia is something that needs to be treated surgically. And again, a consultation with the physician would be immensely helpful in maintaining the health of the gums and the teeth.
So your message is poor oral health has many impact on medical conditions.
Absolutely. Poor oral health should be eliminated if not controlled, because when you look at the long-term perspective, we do have a grave series of irreversible consequences. And when we want to be able to protect the patient's health and at the same time safeguard their mouth, it becomes an important equation there that we need to consider. And we are partners in the health of the patient.
Sure. So what are the oral habits and ill effects on cancer, submucous fibrosis, many other conditions?
It's very unfortunate. Oral submucous fibrosis is unique to our part of the world. Southeast Asia, we chew areca nuts, tobacco, betel nut chewing, the chunam, which is the lime that's mixed with many of our digestives, they have a direct consequence in terms of precipitating what's called as oral submucous fibrosis. That's very unfortunate because it's very, very popular in India. It debilitates the patients by unable to open their mouth. In fact, when a patient came to me, they said, I was fine all this time, now I cannot eat pani puri. So that prompted the patient to come and see us. And with the history, found that the patient was a chronic pan parag patient. So habits like pan parag, manik chand, tobacco quit chewing, reverse smoking, all these precipitate submucous fibrosis. This predisposes the patient to oral cancer. And oral cancer is the third largest type of cancer prevalent in India. It constitutes 30% of all the cancers in India, and that predominantly comes from oral habits. So I strongly urge the public to stay away from these types of recreational products that have a direct consequence in creating cancer and other types of diseases that can cause resection of the jaw and removal of the tongue and other kinds of surgical impairment.
Thank you. So many people goes to regular medical checkup, regular physical exam once a year, every other year. What do you suggest? How do someone prevent getting the oral cancer, or how do they get preventive care in the oral health?
That's a great question. Dental disease is absolutely preventive. I want to put up a sign in my office. This is a caries-free office, or this is a cancer-free office. It's neglect. If you brush your teeth twice a day, you never have to see us. If you can floss and you can maintain your teeth, there is no reason to see a dentist. So it's the problem of trying to know or trying to educate our public that prevention is better than care. I still have patients in their 90s who still have all their teeth. We used to think the older you grow, you have to lose your teeth. That is a myth, right? Dental cavity and gum disease are completely preventable. All you have to do is visit us once a year, and we don't have to do any work at all. In fact, if I drilled and filled a cavity, I have failed. I have failed as a physician in educating my patients that their mouth and their hygiene should be of paramount. So it is something that is absolutely controllable. In fact, there is a saying, dentistry is one profession that's striving hard to eliminate itself. So if I can brush my teeth and rinse with fluoride mouthwashes, stay away from sticky candy, stay away from all kinds of sugary foods, stay away from caramel, there's no reason why you should develop cavities. If you brush and keep the health of your gums, there is no reason why you should lose your teeth. If dentists don't get cavities and dentists don't extract their teeth, I'm sure the population at large should also have the same benefit that we are enjoying. So it is a myth that you will start losing your teeth during pregnancy. It's a myth that you start losing your teeth because you have some diseases. All of this can be completely controllable, and our goal is, I want you to keep your teeth for life.
Thank you. So we all getting old. The life expectancy has increased really longer now. What do you suggest for older age population, 70s, 80s, for their oral health?
Yeah, so it's a good point that you bring up. Our life expectancy in India used to be about 55. So it kept the retirement age earlier as well. Now you're seeing people living to 80s and 90s, and that's what the medical profession has done. Thanks to the advancements in medicine, people are living longer, they're able to enjoy their lives, but unfortunately, the comparative changes are not seen in dentistry. Losing teeth early on will predispose a patient to Alzheimer's disease. Keeping periodontal disease in their mouth in their older age is going to impact upon their cardiovascular diseases. So if you can keep your teeth in your old age and avoid dentures, that is going to enhance the quality of life. It all boils down to how can you chew and enjoy your food properly, how do you maintain your smile, because how you appear has a lot to do with how you appeal to me. So it is a matter of how we can maintain the teeth in its finest form so we can delay the demise of the ability to enjoy a food and avoid dentures at large.
So Dr. Iyer, when we have a patient, old age patient, when they lose their teeth and they need dentures, what are the options do they have?
Well, dentures is a curse. First of all, we want to see what is it that we can do to avoid extracting the tooth. There is no substitute to having our own natural teeth, but there are some unfortunate incidences that may cause loss of teeth. So the most inexpensive way, of course, is to have some dentures, and dentures are not most comfortable because your palate is covered, your tongue is covered, and people are not able to chew and enjoy their foods. That's why we do have dental implants that have kind of revolutionized how patients can manage with false teeth. So now you can make implants wherein the patient will not know, or others will not know, that they have something artificial in their mouth. The aesthetics and the cosmetics of it has improved, and the implants are actually anchored into the bone, so the patients feel that they have their own teeth back. So that's what we call as the third set of dentition that we are able to offer our patients with some fixed alternatives.
Okay. So when we go to dentist, oftentimes we hear from the dentist that, okay, you will need a root canal. What is that root canal is all about?
Well, root canal is one way to keep your teeth because it all starts with a cavity, right? When we don't brush our teeth, there's food particles that stay on the teeth, and they will start to cause the decay. When the decay is not controlled by fillings and through remineralization process, the decay reaches the nerve, and that's when the patients have shooting pain. So once a patient has pain, that usually correlates to a root canal treatment. Of course, dental pain doesn't always have to come with teeth because many a times there is misdiagnosis and root canal is started for wrong reasons. So we always want to be sure that it is the teeth that's causing the pain. Root canal is the last resort in terms of removing the decay and taking the pain away. Root canal is a 1 or 2 visit procedure where we take the nerve out and we restore the teeth so that the teeth can be put back into function. So after root canal, typically what we do is we protect the teeth with some crowns, and that helps us keep the teeth functioning for an extended period of time.
Wonderful. How do you describe cosmetic dentistry in 21st century?
Well, this is the world of smiles, right? Everybody wants to smile well, and everybody requests for so-called Hollywood smile, and soon now it's become Bollywood smiles. So we do have special ways of correcting teeth. We never really looked at pictures deeply. Now you can see, when you see a cover picture of the Vogue, Tom Cruise's smile or Julia Roberts' smile, that is always iconic. And people bring those pictures to my practice and say, I want to look like this. Can you make a smile like this? So we look at this and we do a smile analysis, and that's making dentistry very exciting. And it's also helping our patients flash smiles so their confidence levels is improved tremendously. Before weddings, people come for teeth whitening. Teeth whitening is another important aspect because we do use a lot of staining foods, especially our Indian foods have a lot of haldi, and they coat the teeth with yellow discoloration. And we use chewed pan that also discolors the teeth. So all these stains can be removed with teeth whitening. But of course, there are some intrinsic stains like amylogenesis imperfecta or fluorosis. Many parts of South India and Rajasthan and Gujarat, we grew up in an area where the water is filled with fluoride. And when we have this water, it stains our teeth and becomes yellow and brownish. So we are able to modify those discolorations and make the patient smile better.
So we talked about geriatric population. How about pediatric population or the youth, younger age population? What do they need to do for oral health?
Great, catch them young. So we used to have something called as bottle caries. The mothers, to prevent their children from crying at night, they will leave the bottles in their mouth endlessly, and and the milk is typically mixed with sugar, so the baby feels good. And unfortunately, that resulted in a lot of what we call as bottle caries. People associated that with the milk. It's not the milk that causes the decay, it's the sugar that's mixed with the milk and the constant contact of the sugary fluids in the mouth. Now we're seeing the incidence of bottle caries decrease tremendously. Pediatric dentists are striving hard to implement fluoride therapy. So if you don't go as an adult, the least you can do is take your kids to pediatric dentists and have them evaluated once every 6 months, because the eruptive sequence can cause a lot of irreversible changes. So you want to get them with pristine teeth. So if they can keep their teeth as kids, it will motivate them to keep their teeth when they're adults.
Wonderful. So let's move on to the socio-psychological aspect of oral health. What are the psychological effects of smiles and confidence levels? Because that is the most important thing you do on a daily basis.
Very true. Yes, as I said earlier, how you appear has a lot to do with how you appeal. Smile has been the game changer. If somebody is angry, the moment you smile, it takes away all the tension that prevails. So sometimes we are not always born with perfect teeth, and sometimes you miss some teeth. So many times people put their hands over their mouth when they smile. They're embarrassed. That leads to a lot of depression. That leads to a lot of decrease in self-confidence. If you are in the public eye like a politician, you are constantly being photographed and you're constantly being monitored. And if you don't have a good smile, there's an association that you don't take care of yourself very well. So I would suggest that we do a smile analysis, and that will help improve our confidence. In fact, I have many of our patients who are looking for a permanent solution to be able to smile well, and you don't really always have to be embarrassed. Besides the smile, it's also to do with the odor. When people come close to you, they'll say, I want to turn my head away because his mouth smells so badly. That again is completely controllable. It's not the foods we eat, it's just the way our gums are being maintained and how we can improve our oral hygiene. So the halitosis or malodor of the mouth is not something that you're always associated with. Also think about being with your spouse, and we have this intimate moments, and we want to be respectful of whoever we are coming in close contact. So once in a while we should do our own self-test. We should check and see if we can assess the level of breath, so we are kinder to the audience that we are interacting with, and consult with the dentist. Halitosis is something that we can avoid and we can control. So that's something that we should always be cognizant of.
Thank you. Do you see a disconnect between the providers, the dental or the dentist versus medical physicians about when someone goes for a physical exam, do they need to discuss what dental treatment or what dental issues do they have?
Yeah, that's another very good point, because when we talk about dentistry and dentists, it has always been separated. The people say, oh, he's after all a dentist, why should I tell him what medications I'm taking. Or the physicians, vice versa, will say, but that's dental, that's got nothing to do with medical. So this kind of disconnect has caused a rift in terms of how the patient's overall health is being maintained. Now we are constantly looking for clearance. We ask for medical clearance when we do dental work. At the same time, it's very gratifying to see many of the physicians asking for dental clearance, to ask, is it okay to put these patients on medications? Because there are any prostheses that we should be aware of. We get that before an MRI. We get that when the patient's going through airports because they have prostheses in their mouths. We get that when the patient's going to get a hip replacement. We get there when the patient's getting a heart valve replacement. So this systemic correlation between dentistry and medicine has brought us very close to each other. So the professions are recognizing the value, and it's only going to get better. So eventually the patient's going to benefit from this close interrelationship between the two professions.
So if someone needs to go for oral health or extensive treatment on oral health side, prosthodontics or any specialized care, how do they pay, or does the insurance covers Medicare, Medicaid, out-of-pocket expense, or their own insurance covers those costs?
Yeah, it has been a big battle. In the early 60s, dentistry chose not to be part of this Medicare coverage because of the huge overheads that we had to incur. Slowly we are trying to see that get down. Dentistry should not be for the rich and famous. Dentistry is something that should be affordable. As I said, prevention is better than cure. But there are certain means of defraying the overall cost of what dentistry has to offer in terms of the value. And as I said, if we can get it on a preventive mode, you don't have to get into such expensive coverage. There are some insurances that do cover some of the exotic procedures in dentistry, but there's always a limited coverage that's available to dentistry. I hope in the future Medicare will open up its avenues and consider dentistry as part of the geriatric coverage that they will offer. And the American Dental Association is striving hard to see how we can expand the services to cover the geriatric population.
So the take-home message is once a year, have the annual checkup done.
That is
oral
the
health.
least. Yes.
And what is the last message you want to give to our audience? What is the other important message you want to tell our audience?
Yeah, well, there's always an association of pain with dentistry. We've come a long way. Dentistry does not have to be painful. Dentistry does not have to be an emergency visit, and dentistry does not have to be elective. We are very kind and warm and friendly people. We don't hurt you. At the same time, do visit us at least once a year so we can help you keep your teeth for life and avoid any kind of mishaps and emergency. Our goal is your oral health is our utmost priority.
Thank you, Dr. Iyer. I'm so happy and so honored to have you in the studio for this wonderful topic of oral health, which is neglected by so many people all around the world. And you gave a wonderful information. Thank you so much.
Thank you, Dr. Patel, and thanks again for organizing this together.
Thank you.
Thank you.